Sterile water injections for labor pain relief. Do you see those little dots kind of all around the bottom or that base of the spine? There's 4 of them. What you're seeing here is 2 providers. They have to be trained, right? So if it's at a hospital, the nurses typically are taught how to do this. If you're at a home birth or a birth center, they've been taught how to do this. But once you're trained, they're injecting 2 tiny little blebs, if you've heard that term with like the tuberculosis test, little blebs of sterile water just underneath the skin. And the thought is these sterile water injections, basically what they do is they can distract the brain from the labor pain, the contraction pain that you're feeling, and possibly also lead to the release of more endorphins, which can also help with the labor pain that you're feeling. Typically, it's 4 injections, the 1, 2, 3, 4 that you see. Some people only do 2, some people only do 1. Often it's 2 providers trying to inject them at the same time. The reason someone might not do all 4, because they can really sting. When you are injecting that bleb of sterile water, it's a pretty significant sting and burning sensation. I've had patients who get the first one and then they say, no way, I'm not doing any more. That's why it's nice to have 2 do it at once, because they can do the 2 and the 2 at once. So if you are saying, I want all 4, I want to try this, that you can kind of have just those 2 points of that stinging and burning, as opposed to having to sit through the 4 different ones. And I've seen these most used is probably for those who are going for unmedicated labor. And so this is a tool that they use as opposed to going to an epidural. I will tell you that a big majority of patients that I've seen try these do not love them, because that stinging and that burning sensation, which is temporary, it's not persistent and continues, but that initial sting and burn just isn't worth for them whatever relief that it might offer afterwards. However, I have seen patients and I've had students who absolutely love it, and they continue to do these because you can repeat them throughout their labor, and that's one of their favorite pain control tools.